First, do no harm. While it is not actually part of the Hippocratic Oath, it is what doctors stand by. A doctor's sole job is to heal and to help. They go to years of medical school and then additional years of interning to earn this title. So why is it legal for doctors to kill their patients? Active euthanasia has become more accessible in the past 10 years. It is now currently accessible in 8 countries, pending in 2, and available in some parts of Australia. The most glaring issue is that some of the restrictions are being relaxed on who can receive this procedure. Why are non-terminally ill patients being actively euthanized? In the United States, on graduation day, doctors collect their diplomas, stand to shake hands with their professors, move their tassels, and then stand to recite the Hippocratic Oath. Every country has their own version they follow. For example, Canadians follow their own code of ethics that can be found on the Canadian Medical Association website, and the Netherlands has the Dutch Medical Oath. The Hippocratic Oath on the congress.gov website plainly states, "I will do no harm or injustice to them." Almost identical, the Dutch Medical Oath states, "I will do no harm to the patients." The Code of Ethics on Canada's Medical Association website states, "Take all reasonable measures to prevent or minimize harm to the patient." It also states, "Promote the well-being of communities." These experts are being violated by active euthanasia. According to the National Library of Medicine, active euthanasia refers to the physician's deliberate act under the administration of lethal drugs to end an incurable or terminally ill patient's life. However, countries have started to do away with this key criteria that the National Library of Medicine listed as part of the definition: incurable or terminally ill. On the official government website of Canada, it has the criteria listed for someone requesting a medical assistance in dying. It clearly states on their website, you do not need to have a fatal or terminal condition to be eligible for medical assistance in dying. They even bolded the word "not" to ensure people know they do not need to be dying to ask for assistance in dying. Death should not be a solution doctors are making readily available. How is assisting someone who is not terminally ill in dying doing no harm? There are only a handful of states in the United States that allow a form of euthanasia called physician-assisted suicide. There are key differences on how the U.S. handles this delicate matter. To qualify for physician-assisted suicide, the patient must be terminally ill or incurable. The second key difference is that they do not administer the drug that will end the patient's life. Instead, a drug is prescribed and it is up to the patient to complete the act. In Canada, the most common way of active euthanasia is lethal injection. Currently, you do not need to be terminally ill to request physician assistance in dying in Canada. For example, someone who is wheelchair bound would be eligible to request for assistance with dying even though they are otherwise healthy. While it is not available yet, Canada is promoting on their official government website that they will be making medical assistance in dying available to people suffering from mental illnesses such as depression in March of 2027. There are many medications and tactics that could be used to alleviate these ailments, so the government should be working to make those more publicly available instead of promoting death. According to Dorrance University, euthanasia is now the 5th most leading cause of death in Canada. Is the accessibility of euthanasia now making it to seem like an easy way out? There are many websites like dyingwithdignity.com that promote euthanasia as a positive solution. While it can be a positive solution for terminally ill patients, is it being misconstrued by the general public as a possible way out for them? Dorrance University also noted that the most common cited reason for euthanasia requests are the loss of ability to engage in meaningful activities or to perform activities of daily living. Just under 60% cited inadequate pain control, while over 20% cited isolation and loneliness. If 20% is already reporting isolation and loneliness as their reason for requesting medical assistance in dying, imagine how much higher that will be in March of 2027, once it's made available for people suffering from mental illnesses such as depression. Instead of promoting a way out for people who are suffering from isolation and loneliness, the government should be promoting therapy, outpatient programs, support groups, and medication. There is a mental health crisis, but death is not the solution. Dying with dignity is, of course, important. We never want our loved ones to suffer or to lose their sense of worth. When a loved one is in pain from late stages of cancer, physician-assisted suicide might be a solution for them. Physician-assisted suicide for suffering terminal patients is compassionate. However, it is not compassionate to legalize lethal injections for non-terminally ill patients when the same country already deemed it immoral to lethally inject inmates on death row. Active euthanasia for non-terminal patients is not a solution. Death is not a prescription.